Hey guys, welcome to the season 2 of GirlUp Mukti Podcast. We are your host, Tushang Bhardwaj.
And Michelle Singh Olak.
We are the inner voice that tells your story, our story. So Michelle, are you excited to kickstart this new session of Mukti's podcast?
Absolutely, Toshang. This season will be packed with some amazing and insightful sessions for all of you. Dr. Apurva Palam Reddy is a consultant in reproductive medicine, reproductive endocrinology, and gynec endoscopy with 13 years of experience. She has contributed greatly to the field of gynecology and reproductive health and won several accolades in her field over the years. She has authored several works like an FAQ on gestational diabetes mellitus, prenatal diagnosis of fetal abnormalities, multidisciplinary approaches for prenatal diagnosis. She has also co-edited the book titled Decoding Polycystic Ovary Syndrome, also known as PCOS, and reviewed articles for the Khyber Medical University Journal.
Good afternoon, ma'am. Thank you so much for agreeing to talk to us.
My pleasure.
So, ma'am, teenage pregnancy is seen as a taboo in India.
Mm-hmm.
So, ma'am, what are your thoughts on it? Like, have you come across any cases of teenage pregnancies in your career till now?
Of course, I mean, it's definitely a concern not just in India, but globally that way. That's primarily because of lack of sex education at a very young age, and lack of idea about how contraception works, or what are the do's and don'ts. Also, the concern for us now as medical professionals, we are mainly concerned about the health status of the teen.
Yes,
Apart from, of course, the mental impact that the pregnancy in itself or the abortion is going to kind of have for them over a long term. So, teen pregnancies are associated with a higher risk of anemia, risk for the child, preterm labor, heavy bleeding, postpartum hemorrhage, a whole lot of spectrum of medical conditions, you name it, and all those problems can happen in a teen pregnancies, and teens are at a high risk of developing that. So, which is why I think medically it is relevant for us to kind of make sure that they don't get pregnant till that point. And also from a legal aspect, 18 is what is considered as acceptable.
Yes, ma'am.
So if, as a medical professional, you see that there is a teen, 16, 17, 18, if she is less than 18 years, we are legally bound to report that pregnancy to the local police authorities, because then it comes under a certain act as what we call as a POSCO Act.
Okay.
Wherein considered as a charge of rape,
Okay.
even if it is done consensually.
Okay.
So, which is why I think it's extremely important that 18 is considered as the age wherein you can legally give your consent for sexual intercourse.
So, ma'am, is it the app? Is it like important when there are child marriages in villages?
Of course. So, which is why that child marriage is not legal in
Yes.
India. Anyone can kind of report it, and the police officers or the authorities who are there in the space are bound to kind of stop something like that. And you don't have to be even related to the family to kind of actually report it. You can be someone who's even passing by through that space, and you can still report it.
Okay. So, ma'am, till now, is there any cases you've come across of teenage pregnancies?
Fortunately, probably because we do practice in a metro,
Yes.
and that the kids here probably have a better access to contraception. So we've had cases only that have gone beyond 18.
Okay.
But yes, when we were doing our post-graduation, we did see pregnancies, 16 years and 15 years. And interestingly, some of them used to be married as well.
Okay.
So they've already been married for a couple of years, and suddenly at 16, they're pregnant and they're coming to you for help.
Okay. So, ma'am, I can say that teen pregnancy is more in the rural area than in the metropolitan cities.
I wouldn't. Statistics is something it varies from place to place and the kind of area that you're practicing as well. Like if you are practicing, let's say, in the peripheries, then the probability of you getting exposed to or coming across someone who's having a teen pregnancy is much higher, because again there is a taboo that they don't want to go, let's say, to a big hospital, or let's say a bigger setup, or bigger doctor, and consult for something, because they feel that they might get judged, or they might not get the right kind of treatment, or it might be too expensive for them to kind of afford it. So these kind of issues also step in, and I think that's the reason why a particular doctor might or might not be exposed to those many number of cases. But that doesn't mean that it's not happening, or that doesn't mean that it's not a concern.
So, ma'am, what is the reaction of parents when they get to know that their child is pregnant?
So interestingly, I think I've recently had a case where, of course, she was not a teen. She was 23 years old. I think the family kind of knew the guy as well, because he was a relative, and she was already 16, 17 weeks pregnant, and so beyond 7 weeks of pregnancy, it kind of it's not safe for us to terminate the pregnancy using medications, and obviously that is where a surgical procedure will kind of get involved. And beyond 12 weeks of pregnancy, we need to take consent from 2 different doctors for a termination to be performed. So it was the mother and her aunt who had actually brought her for the care, and so they had just realized that she was pregnant, and she was already having PCOS, which will cause irregularities in the period. So she never realized that she was pregnant also. And I think after 4 months, because the mother forced her, is when she actually took the test, realized she was pregnant, and the entire family, her brother and everybody were there. Were they happy about the whole thing? No. Were they supportive about it? Definitely yes. So and of course we do get patients who have not informed their parents about it, or who are not involved in the decision for the termination itself. So again, if you're 18 and above, you don't need the consent, or we as medical professionals don't need the consent of neither their partner nor their parent for us to go ahead and perform a safe termination.
So, ma'am, at times, like I read it in the newspaper, that at times teen or even people above 18, they want to abort the baby, but maybe it's due to some afraidness from the society, that what they might say, or maybe the parents don't want others to know, they don't abort the baby. So what emotional strain does it bring upon the the patient? And
so I genuinely don't think the percentage of people who would actually carry the pregnancy forward completely for 9 months, for someone who's not married, and that irrespective of how the parents feel about it, I don't think they're going to let her through the 9 months. The probability of that is very less. The concern where all the factors that you have said come into picture is they do realize that they're pregnant at 6 weeks, but it takes them almost another couple of weeks, and hopefully not months, to kind of actually gather the courage to go to a medical professional and get the procedure done, or arrange themselves in a financial space, or figure out where they are in the whole process of it. That delay is what is of concern. So again, as I said, that's because below 7 weeks, a termination can be performed safely using medications, and the risk of such a termination are going to be minimal, on the woman, as compared to terminating a pregnancy which is already, let's say, 12 weeks or 13 weeks per se.
So, for example, a person decides to do not abort the baby. So, what kind of effect, or what are the risk factors involving with the baby, for the baby and for the mother?
So, teens is where there is a huge transition that is happening in your own body, and it's probably not the best of the times for you to really be having a nutritious food and a healthy lifestyle, or regular sleep pattern, or the stress of exams, and career shifts, and a whole lot of things are going on during that time, and they don't just like that, say the teens.
Yeah.
So, in a similar tone, even with respect to pregnancy, so if you're already anemic, if you're deficient in vitamins, and if you're not following a particular lifestyle of, set sleeping hours or, set exercise and rest and nutrition and things like that, it is going to affect the growth of the child.
Yes.
And that can manifest in different ways. As I said, either the weight of the baby at birth might be too low, or she might go into labor too early.
Yeah.
Post delivery, she might have more bleeding, and all those risk factors, of course, from a medical point of view, set in. But even from an emotional point of view, I think it is, we get even women who are at 30 and probably who've been married for, let's say, 4-5 years, and they still say that, okay, I don't feel emotionally and mentally prepared to kind of have a child.
Yes,
Which is perfectly all right. I don't think we should have the pressure that someone should have a child because they've been married for so many years.
Yes.
Now, place a teenager in that situation wherein she is kind of forced to actually have that pregnancy, where she is dealing with her own emotional changes, and so that
Too much hormone change.
absolutely. So that is going to kind of definitely have a long-term
Impact.
emotional impact on the person, and that can manifest in any way. I'm sure there are women who come out of it strong, and on Instagram you always see these
Yes.
stories of single moms raising beautiful kids and doing everything brilliantly.
Yes.
But we are just seeing 2 minutes of a clip,
Yeah.
and that really cannot be comprised into a life, and not everyone might be as accepting, and it might be difficult for them to kind of constantly be under that scrutiny, and constantly having to justify just existing and doing what they want to do.
So there's this clip on Instagram I saw like a few days back. So this girl was in class 10. She had her first pregnancy. So usually when you are pregnant in your teens, even if you don't want it, you try to stop having it. But then 2 years later, she again had a baby and again had a baby. So, and her parents were quite supportive. And still they graduate, their high school, they go for their jobs. So do you think that kind of behavior or that kind of, I don't know, confidence is there in India? Like
no, it's not legal, first of all, as I said. It's not legal. So no matter how supportive you are, and so they're going to come after everyone. They're going to come after the principal, for not reporting it. Come after the parents for not reporting it. Come after the doctor for delivering them and everything else. So below 18, you are legally bound to kind of report a pregnancy because it is going to come under the POSCO Act, wherein it's like a Child Protection Act kind of thing.
So I would say that India has stricter rules when it comes to child protection.
I think yes, in a way it's good, and a way I think it is progressive, because that is going to kind of put at least some amount of limitation.
Yes.
See, every law, they kind of keep saying that a law is made to kind of, or it's meant to be broken.
Yes.
But then the probability or the percentage of people who would actually kind of go all the way out to break it is going to be less,
Yes.
as compared to the number of people who would kind of abide by it.
Yes.
It's like you have a law wherein you can't have a liquor store next to a school.
Yes.
So it's not that the kids won't go to a liquor store, let's say 5 kilometers away, and kind of pick it up.
Yeah.
But then if you are exposed to it every single day when you're coming to the school and going back into the school, the chances of people just randomly wanting to pick up is much higher, as compared to saying that okay, I am going to go all the way
5
to,
kilometers.
yes, and try it.
So, ma'am, do you think schools and communities are giving enough information to the kids on prevention of teen pregnancies, and are they giving them enough knowledge about contraceptives?
So I think that is where the point actually comes in, that we are focusing on, termination and abortion and, getting teen pregnancy. And, why should anyone kind of get pregnant if they do not want to?
Yes.
So focusing on sex education, contraception, I think are the most important things. And if parents are not going to do it, and if teachers are not going to do it, they are going to just get the information online.
Yes.
And nowadays with the internet, anyone can kind of randomly just pick up a phone and post information,
Yes.
which can get directed in the form of sex education, and that might or might not be true.
Yes.
It's not like making a puree or a paste of a certain fruit and saying that okay, this is going to bring miracles into your life.
Yes.
So yes, I think one, having a good sex education and understanding, taking away probably some amount of curiosity in it, and actually giving the right information for them probably makes more sense. And making contraception accessible. I think a couple of days ago there was a clip wherein in one of the schools they randomly did a search, and they found condoms and pills and cigarettes and everything in school kids. And the response for that is that okay, now we're going to stop selling condoms to kids. I think it's as difficult as it is for you to probably comprehend with it or understand with it, that just the fact that okay, they're using condoms, I think in itself we should kind of say okay, thank God.
They're using
Yes. Okay. So if you are going to kind of make it even more, I could count and say just randomly that about 20 or 30 guys who would even at the age of 30 feel very uncomfortable to go to a medical store and kind of pick up a condom or ask for it.
Yeah.
And likewise with women also. So if you are going to make it even more hard for these kids to kind of actually access contraception, so how are you going to kind of prevent the problem of a teen pregnancy?
And I personally believe that if a woman wants a contraceptive,
Sure.
it's really difficult for her to go to the chemist because
Yes.
it's really embarrassing for them.
Yes.
I think they should
And the
normalize
problem,
these things.
yes, the problem here, I think, is we're not very well used to the concept of a female condom.
Yes.
So for women, in case if you talk about contraception, we have to either rely on the male partner,
Yes.
that and that they use a barrier, or you have to kind of move to a medical or a pill-based contraception, either oral contraceptive pills or the most terrible one that is available, that is your unwanted or your emergency contraceptive pill.
So, ma'am, what age do you think is the best for parents to open up to their kids about sex education?
I think it's a decision that the parents should kind of actively take, because not every child has the similar intellectual ability. Like for example, I think girls have a sooner intellectual ability as compared to boys. So you can't put a single line on it and say that okay, once they're going to hit 5th standard or 6th standard, I'm going to go take them and I'm going to give them sex education. I think obviously as parents see the child grow, they understand what are the phases that they're going through, what are the conversations that they're having with their friends, what are the kind of questions that they are kind of
Yes.
asking you, or what do they get embarrassed about when they see in public, or when they're kind of interacting.
Yes.
So based on those aspects, I think it's a judgment that parents have to take, that when they decide to kind of give them sex education. But from a government perspective, I think the 8th, 9th and 10th standards, I think, is a reasonably good time
Yes.
for obviously someone who's setting the curriculum might be a better person to kind of understand, because they are the ones who decide when multiplication gets added into the syllabus and when addition gets added. So in a similar way, I'm sure there are methods where they can evaluate which would be a better time to kind of add regarding sex education.
And mom, parents should be open about this. I mean, I've seen parents being a little strict or being, conservative, especially when it's a conservative family and it's a joint family. So how should like most of the time when we talk about teen pregnancy, it's mostly relatives involved. So how should parents be encouraged enough to listen to their child if something like rape happens to them.
Sure.
So how should parents be encouraged? Like, should be there any workshops, sessions from the government or something like
I
that?
think it's a very, very tricky space to kind of be in, because I think this is simply the kind of relationship that you're developing with your child. You know, the kind of trust that you have in what your child is telling you, and to probably certain extent be able to differentiate and understand if I don't think any kid would kind of, come and really joke about it and
Yes.
say that, okay, this is something that has happened. And if they were to kind of really say it that way, the two concerns that come for the parents is, one, obviously, how do they kind of even confront it, and of all the backlash that is going to come up, and how it is going to eventually be traumatic for the child also. And of course, and the second aspect is, okay, that do we even trust him
Yes.
or not? So this is the better part, I think, where the child is coming and telling you about it. I think that's the better part. I think the worst part is when, the child is not even coming and telling you, and he or she is just suffering in silence. And at those points or those aspects are when, as a parent or as a teacher or as someone who's kind of seeing the child on a regular basis, wherein we need to pick up those subtle changes
Yeah.
as to change in the behavior or mood, or how they're attracted from their peers. So
Yeah, at times they get scared when
Yes.
that simple person walks into the room.
absolutely,
They want to go
absolutely,
inside.
absolutely. So I think it's all of that. I don't think any parent would kind of be all right with it or comfortable with it about the fact that someone has not treated their child right. The entire backlash that's going to come, and how they are going to kind of respond to it, and the choice is how you have to face the entire
Yes.
world as compared to how you have to kind of manage your household.
Yes.
So
And ma'am, like when mothers come to you, like teenagers come to you, so is there any counseling sessions provided by you guys?
so we do have counselors.
Okay.
That and that sometimes giving information at the right time is also equally important,
Yes.
and they have to be receptive at that given point.
Okay.
So which is why when they initially come to us for the termination, we don't kind of discuss too much in details. We are going to give them a plan forward as to how the termination is going to be done,
Okay.
how safe it is going to be for them, how are their follow-ups supposed to be, and if not, something like this would kind of negatively impact them, their medical health in the future. So these are just aspects, clean and simple, and that's the last thing that she wants to hear from me, as to how she shouldn't have got pregnant, or
Yes.
that how this might kind of affect her mental ability and so on and so forth. But we do call them back to kind of ensure that the termination is complete, probably after 7 days or 10 days. And when they come back, when they know that they're not pregnant anymore, and that they know they have survived through this and they have come on the other side. So this is the time that I take to talk to them about contraception,
Okay.
and to kind of just check on them, how they are in an emotional state, and how they are with their partners, and if it has been consensual, and so on and so forth.
So, ma'am, how long is this abortion, like procedure? How long is the procedure?
So once the pills are given, it takes about 7 to 14 days for the entire process to kind of happen naturally.
And surgically,
That's just half a day thing. Yeah, you just get admitted in the morning, and by afternoon you should be good to go. The sedation or the anesthesia what we give also will be kind of given through mask,
okay.
so you don't get any spinal injection, or there's no pain
Okay.
basically. And because it's done vaginally, you do not have any skin cuts, or there are no lesions and things like that.
Okay.
So essentially, you should be able to kind of get back to work from the next day. So it's just going to be like a very bad period.
Okay. Are there any cases where, like, the person wants an abortion, but somehow it's too late, or there might be way too much complication to the mother if the abortion happens?
Yes. So that's where you go beyond 20 weeks pregnancy.
Okay.
So termination beyond that point is not going to be simple, either medically or surgically.
Okay. So the person has to go with till the end of the pregnancy.
Yes.
Okay.
So legally, as I said, we can do a termination only between 20 to 24, less than 20 to 24 weeks.
Okay. And ma'am, like you said that it comes as a rank of possible if a teen gets pregnant.
Yeah.
So what happens to the partner, even if it's consentful?
They go to jail.
Okay, so
It is, as I said, so even if it is consensual, if it is less than 18, it is considered as rape. Again, in the last couple of weeks, I'm not sure if you've seen some in North, somewhere in UP,
okay.
the village was kind of raided, wherein, all of them were married couples.
Okay.
And but obviously all of them have had child marriage. So someone was 12 when they got married, and someone was 16 when they got married, or 14, and they have arrested all the men
Okay.
because it's child marriage, and even if it is done consensually, and it is about having sexual intercourse with someone who's less than 18. Again, when we are in a medical space, it becomes very difficult for us to kind of give an emotional advice, or that how do you say, a non-medical advice. It becomes difficult for us because maybe we're not allowed to do that. It makes it even more difficult for them to kind of come and seek medical help from us.
Yes.
But I think every step of it, or every phase of your life has to kind of happen at a certain time.
Yes.
If it happens too early also, it is going to kind of have impacts. If it's going to happen too late also, it is going to have some impacts. So if you actually involve yourself in sexual intercourse, or sexual intimacy less than 18, I think it's a very, very naive and early age for you to really comprehend the whole process of it, and without it having any long-term effects over your mental health.
Yes.
I have seen so many couples who've been in a relationship, and who've had who've got married eventually, and now they're in their 30s. And now they just feel that, okay, there's nothing left to do. Or, they just feel that, okay, this is it. And, we've been there, done that. And, now now nothing kind of excites them anymore. Or, there's really nothing to look forward to. So, I think sticking to that space of 18 is
important.
Yes. Not just medically, but I think from...
mental point of view.
Yes,
also, because
yes.
we all have our school, our colleges.
Absolutely. And it's too much of an emotional that emotional turmoil to kind of go through all of that.
Yes.
I have patients, young girls, who kind of come to me after 1 year, 2 years, and say that, doc, we want to get a STD checkup done. So I will, when I kind of inquire about, okay, when is the last time you've had unprotected sex? It's like 2 years back.
Okay.
So, think about it, that, for 2 years, every single symptom that she has ever experienced, every single rash that she's got, or, fever that she's developed, vaginal discharge that she's had, UTI that she's had. So she's constantly under the pressure that, what if I got an STD from that one act? And this internet, and this kind of information, they will keep telling you that it can happen anytime, and that you will get to know. I got to know after 5 years, and all of that stuff. And it's a huge emotional turmoil also for them to kind of actually go through it.
Yes, and like I have personally seen things on the internet where that symptom will be considered as a normal symptom, so you don't have to worry about. And that this person keeps on thinking and thinking, that itself stresses that person.
And as I said, that kind of affects the client so much that now they're like, doc, we don't want, and we don't want to get pregnant, and we don't want to have intercourse and things like that. Yes. So the every time I think we kind of even do a termination or abortion for someone not married or someone not keen, when I discuss with them regarding contraception, the first thing that they're going to tell is that no, doc, from now on I'm not going to have sex only. So that's like their first response or reflex. Obviously, that's not going to be possible, and so yeah.
So, is there any tips or any suggestions you want to give to people who are curious during that time? Because I guess 16 or 17 is the time you are so curious that you want to try out everything, especially when you're not getting that enough knowledge from your parents or from the school. Like, because even I remember when I was in class 9th and 10 and we have this reproductive chapter.
You want to skip school that day.
Yes.
You simply want to skip school and you don't want to see any of your friends.
Even at times teachers they would skip that specific parts.
Yeah.
So how do you think, like, what advice do you want to give to
I'll have to tell you about a consult that I had done some time back, and that kind of really left a mark with me. So this was I was doing a virtual consultation for a couple. The guy was in one city and the girl was in another city, and obviously I'm in Bangalore, and so we were doing a virtual consult, and I was asking them. So the whole agenda for the consult with me was that they were their boyfriend and girlfriend. They're in a long distance relationship. They're meeting now for the first time, and now not for the first time. I think they're meeting now. And they have decided that, this is the time when they want to go ahead and have sex.
Okay.
So they discussed at length with me regarding, that what is the best contraception that they can use, is it safe to use condoms? What is latex allergy? Can we use a lubricant? What is a flavored condom? And a whole lot of discussion. I was so amused to see, do that consult. And, I was so proud of them that, they actually reached out and connected, which definitely takes a lot of courage, and I think which is very, very responsible.
Yes.
So I think for teens or young adults who are kind of trying to explore the whole idea, or who are wanting to kind of understand the space, I know that there are doctors who are judgmental, and but then that is there in every given profession.
Yes.
You cannot expect one person or one doctor to kind of behave exactly the same way how we would.
Yes.
But then, fortunately, I think especially in our generation, there are a whole lot of new generation doctors, or who are very open to the idea of this, who are non-judgmental.
Yes.
And who are comfortable in making this conversation, and stick to giving only medical advice, and not push their sense of morality into the whole thing. So figure out one good doctor. You need a gynae through your life. You need one gynae through your life. So figure out a doctor that, and let them make them a part of your journey from your teens to your adulthood, and your marriage, your preconception, your pregnancy, and managing your postpartum and everything else. So
if we talk about the rural areas, so most probably if we talk about government hospitals, the staff is not that friendly.
Yes.
And if a girl really wants that advice, and if she wants to opt for a private, then it's expensive for her.
Yes.
So in those circumstances, what can she do? Like,
I think that is where spaces like GirlUp or that organizations like this will come in, wherein you are giving free information. You are giving the correct information. You are bringing up professionals who are the best in their team, and giving out information to them.
Yes.
So in the current age of, I think, internet, there is nothing that's called as a small town or non-accessible or expensive.
Yes.
If you want to seek the knowledge, I think that is right there.
Yes.
You just need to kind of reach out.
Yes, I absolutely agree with this. Well, ma'am, it was really lovely talking to you.
My pleasure.
A lot of things.
My pleasure.
And I hope our audience also gets to know a lot of things about that.
Definitely. Thank you so much.
Thank you so much, ma'am.
So that's it for today's podcast.
Hope you all enjoyed the show.
But wait, stay tuned for our next episode, which will be out soon. Till then, stay safe and keep calm.
The podcasts are available on your favorite streaming apps, including Spotify and YouTube.